when I was in college not that long ago, people were not really talking about social entrepreneurship. I feel that it's only in the last few years that the social innovation entrepreneurship sector has really picked up steam. And still, there is a lot of misunderstanding about what social innovation really is. Actually, one of my favorite misunderstandings, and I say favorite, but I really mean annoying, is when people tell me that impact startups cannot be as profitable as normal startups. So my first question is for Neetal and Zahin. How is social innovation or entrepreneurship different from traditional innovation?
Yeah, so that's a great question, and Melina, you come from such a rich background in all of this, so I really appreciate that. If this is what you're hearing in your circles, and then it's really a true question. And I think one of the big shifts or unique parts of social enterprise is the acknowledgement or addressing of impact through impact measurement, through kind of realizing that companies don't only make profit, but they are, they are also, they should be responsible for, stakeholders, not just shareholders. And I think that's a shift in mindset, because especially in corporate law and in the history of corporations, there's always a focus on the shareholder wealth. Maximizing shareholder wealth is a buzzword or key phrases. But I think with social enterprise, we're expanding that idea and really focusing on the stakeholders, including the communities that are impacted, including the environment. And that really is a huge shift.
If I can add a little bit to what Neetal has shared, definitely agreed that we're seeing the move from simply maximizing wealth for shareholders to having a more ecosystem approach to integrate the needs as well as the consequences for stakeholders. But I think where I would, distinguish social enterprises from more traditional startups or businesses would be on sort of the fact that we're considering external value. So when we're designing a startup and a company, it's more, it's very internally focused. It's about the internal processes, the staff, the shareholders, and it's very inward looking. And we're talking about value creation. It's moving from inside out. But I think when we're talking about social entrepreneurship, it's addressing the tragedy of the commons. And it's understanding that as businesses, it's not only about how we create value for the company and again, the shareholders, but how are we factoring for the consequences of business conduct in the communities that we operate in, and more so on the planet. So I think it's about embedding external value into the existence of the business.
And remote work, but on the other hand, it has also surfaced new challenges, which can be turned into opportunities. And healthcare obviously is top of mind. So Justin, you started Contakt World literally as a response to the pandemic to improve healthcare communication, which also goes beyond the pandemic. And Dr. Shantanu, you are publishing a book that I will put the link to in the chat in just a minute, about healthcare after the pandemic. So what changes do you both see, both in the healthcare, but also in the social sector after COVID-19? And what do you advise the entrepreneurs in the audience to do to take advantage of those changes while designing, thinking, and building their ventures?
For the first question, I think that we're going to see changes in accessibility of healthcare. What the COVID-19 pandemic has shown us, it's been the great revealer of inequities in our healthcare system, and then taking an honest look at our healthcare system, at least in the United States. We spend more money than anywhere, but we also have the lowest quality of care, and that means that we're going to see innovation in the way that our especially marginalized populations can access healthcare.
It seems a little extreme, but I think society has changed more in the last 12 months than it has in its sort of modern history. And I think that's profound in terms of the shift. And so I think the way that I've made sense of this change is that I really think the future of society has accelerated towards one that is distributed, that is digitally enabled and decentralized. So by distributed, I mean that services are going to happen much closer to the people who need those services, so at home and in the community, right? By digitally enabled, what I mean is that you can use data and technology to strengthen human relationships, right? So again, my patients that text me doesn't substitute for seeing me, or my daughter who emails with her teacher doesn't substitute for having care in a classroom, or teaching in a classroom, but it augments it. And then finally, decentralize. What we're seeing is that we really need to allow clinics and schools to make the decisions for themselves.